Welcome all for the today's class. Today we continue with our pharmacology module, and today's topic is the mechanism of action of antibiotics. Okay, so what exactly the antibiotic means? The antibiotic, the word is derived from the antibiosis, that is the against life. The meaning of antibiosis is against the life. Basically, these antibiotics, these are the organic compounds which are produced by the microorganisms. They are toxic to other microorganisms at a lower concentration. Okay, so the modern antibiotics may be natural, they may be semi-synthetic, or they may be synthetic also. Okay, so what is the basic principle? The basic principle of the antibiotic action is that they inhibit the growth of the bacteria and kill the bacteria. So we have actually bacteriostatic and bactericidal type of antibiotics. So what are their targets or the targets of the antibiotic? One, it is a cell wall. Second, it may be cell membrane. Third, it may be the protein synthesis in the bacteria. Fourth, it may be the nucleic acid synthesis in the bacteria. And fifth is the folic acid synthesis. And this is going to be the very important thing, because they are going to ask you the mechanism of action. They will give the name of the antibiotic and they will ask you the what is the target of this antibiotic. Okay, so that is the thing you should know. The antibiotic, to which class it belongs, and what is the mechanism of action of antibiotics for that particular class, that you are supposed to know. Okay, so as I mentioned, there are mainly two types. One is a bacteriostatic and second is a bactericidal. So bactericidal will kill the bacteria, while bacteriostatic will inhibit the bacterial growth and multiplication. Okay, so these are the two basic types, and you should know the few examples from each. Okay, especially the bacteriostatic that we'll see in subsequently. Okay, so the if you classify the antibiotics based on their structure, so the classes are, one is a beta-lactam, okay, in which you have penicillin and the cephalosporins. Okay, so beta-lactam, you have penicillin and cephalosporins. Then macrolide type of antibiotic, in which you have erythromycin. Then tetracycline, that is doxycycline is the example. Then you have quinolones. Okay, in quinolones you have ciprofloxacin. Then you have aminoglycosides, example is gentamicin. Then you have sulfonamides, sulfomethoxazole is example. Then you have glycopeptides, that is vancomycin, and oxazolidinones. Okay, so oxazolidinones, the example is a linazolid. So these are the different classes of the antibiotics, and you should know the examples of each class. Okay, now what is the mechanism of action? The first mechanism of action is the inhibition of the cell wall synthesis. Understand, this is also one of the very frequently asked SBA. Okay, so inhibition of the cell wall synthesis. So important concept here is that in the last session, what we have learned is the structure of the cell wall. So how the bacterial cell wall is made up of? It is made up of peptidoglycan, and the components of these peptidoglycan are NAG and NAM. Okay, NAG and NAM. This is a sugar. Okay, so N-acetylglucosamine and N-acetylmuramic acid. That is what is the structure of the cell wall. And then there are peptide chains, and then there is a cross-linking of the peptide chain that we have seen in the last session. Okay, so bacterial cell wall is made up of peptidoglycan, and the components are the N-acetylglucosamine and N-acetylmuramic acid. Okay, and now there is a cross-linking. There are peptide chains which are attached to which NAG or NAM, they are attached to NAM. Okay, N-acetylmuramic acid, these peptide chains are attached, and there is a cross-linking of the peptide chain by the penicillin binding protein. This all we have seen. Okay, so now this cross-linking of the peptide chain, that provides the strength and rigidity to the cell wall. So that is what is the basic strength of the bacterium. Okay, so if you see the various mechanisms what we are going to discuss today, the antibiotics which will act on the cell wall. Okay, so this is the outer cell wall, this is the cell cytoplasm, this is the cell membrane. Okay, and gram negative will also have another outer membrane. After this cell wall, there will be another outer membrane, and between the cell membrane and this outer membrane there is a periplasmic space. Okay, so this is what is the gram negative, and this is gram positive will have this thick cell wall made up of peptidoglycan, and then there is a cell membrane. Okay, now the cell wall synthesis, which antibiotics will act? Beta-lactam antibiotics, vancomycin, and bacitracin. So these are the three antibiotics: cell wall synthesis, beta-lactam, vancomycin, and bacitracin. And in beta-lactams, what we have? Penicillin, Cephalosporins, carbapenems, and monobactam. So these four plus vancomycin plus bacitracin, they will act on the cell wall synthesis. And there is a little difference between the beta-lactam and vancomycin and bacitracin, how they act at the level of the cell wall. That also we will see. But cell wall synthesis, at least these three things. One, it will be beta-lactam. Second, it can be vancomycin. Third, it can be bacitracin, that you should remember. Okay. Now, coming to the ribosomal structure. Okay. So, this in bacterium, the ribosome is a 70S ribosome. In human cells, it is a 80S ribosome. Okay. And this 70S ribosome in the bacteria has got two subunits. One is a 50 subunit and another is a 30 subunit. Okay. So this ribosome has got two subunits. So bacterial ribosome is a 70S ribosome. Don't go for the mathematical calculation, that is 30S and 50S, not equal to 70. The bacterial ribosome is a 70S, that you remember, because that can also be asked as a question. Human ribosome is a 80S. Okay. And this ribosome has got two subunits. One is a 50S subunits, another is a 30S subunits. Now there are few antibiotics which will act on 50S subunit. There are antibiotics which will act on the 30S subunits. Okay. Now let us see which antibiotics will act on 30S, which antibiotics will act on 50S. Okay. 30 is smaller than 50. Okay. So the earlier antibiotic will be starting from A. Okay. So aminoglycosides. Remember, aminoglycoside will act on 30S subunits. So examples of aminoglycoside, you know, gentamicin and other like which one is there? Other aminoglycoside, gentamicin and commonly used?
Streptomycin.
Yes, streptomycin. Okay. Then another one which acts on 30S is a tetracycline. Okay. So 30, it begins with T. So T. Okay. Or short forms, you remember AT. Okay. So 30 is smaller. So the first A will go to the 30 and tetracycline 30 for T. Okay. So tetracycline and aminoglycosides will act on 30S. So this is also SBA. This aminoglycosides act mechanism of action by inhibiting 30S subunit, by acting on 30S subunits. Now let us see about 50S subunit. Okay. Now for 50S subunit, remember CMO. Okay. CMO, chloramphenicol, macrolide, and this other group which begins with O, that we will see. Okay. So this macrolide group of antibiotic is there, clindamycin is there, linezolid is there, chloramphenicol is there, and streptogranins are there. Okay. So that will act on the 50S subunit. Okay. Then rifampicin. Rifampicin act on RNA polymerase. Remember, R for R. Okay. Rifampicin, rifampicin will act on RNA polymerase. Okay. Now DNA gyrase, quinolones act and inhibit the DNA gyrase. Okay. Then there are antibiotics which inhibit the folate synthesis, that is sulfonamides and trimethoprim. Okay. Folate, sulfonamides, and trimethoprim. Okay. That this also we know which antibiotic inhibit the folate synthesis. And there is antibiotic which act on the cell membrane. Cell membrane is inside. There is only one antibiotic, that is polymyxin. Okay. So this is the overall thing what we are going to discuss in today's session. Okay. Now the antibiotics which are acting on the cell wall, that we will go into the detail. Okay. So you have one beta-lactam group. Second is a vancomycin. Third is a bacitracin. Okay. Now there is a little difference in the action on the cell wall among these three. Okay. Now what is the difference? This beta-lactam, normally they what these beta-lactam antibiotics do? They bind with the PBP. Okay. So they will bind with the protein, penicillin binding proteins, and they inhibit the transpeptidation reaction. Okay. So the cross-linking which is happening among the peptide chain, that is through the PBP. But what these beta-lactam antibiotics do? They bind with the PBP. So there is no cross-linking. They inhibit the transpeptidation, and that is why the cell wall become weak, and there will be rupture of the cell wall through the osmosis. Okay. So that is how the beta-lactam antibiotic will act. Okay, so basically this PBP identifies the segment in the uh, peptidoglycan cell wall. This DLA sequence they identify, and then they bind with the PBP. Okay, now what happens? This beta-lactam antibiotic mimic this sequence DLA. Okay, so this particular sequence, the beta-lactam antibiotic mimic this particular sequence. That is why they bind with the PBP. So PBP, instead of uh, finding this site on the peptidoglycan, this also mimics this particular sequence in the cell wall. That is how the beta-lactam antibiotics. How the vancomycin acts? The vancomycin binds with the DLA sequence. Normally, the PBP binds with the DLA sequence, but here the vancomycin binds with the DLA. I hope you are getting it. The beta-lactam binds with PBP and then prevents its joining with the DLA, while vancomycin binds with the DLA sequence. Okay, and that is how PBP cannot bind with the DLA sequence. Okay, so and third is a bacitracin. Bacitracin blocks the precursor transport of this peptidoglycan. This cell wall is made up of peptidoglycan. Now, whatever are the precursors of this peptidoglycan, they are coming from here. So what does this bacitracin do? They block the precursors of transport of these precursors of the peptidoglycan. So cell wall is not getting formed. That is how the bacitracin acts. Okay, so the examples of the beta-lactam antibiotics are penicillins, cephalosporin, carbapenems, monobactams. Okay, this also you remember: penicillins, cephalosporins, carbapenems, and monobactams. These are beta-lactam antibiotics. Now, as I mentioned, beta-lactam ring mimics DLA sequence. Okay, so these beta-lactam antibiotics have got a beta-lactam ring. This mimics the DLA sequence and that binds to the PBP, so prevents the peptidoglycan cross-linking. The cell wall becomes weak and there is a bacterial lysis. They have got a bactericidal action. Okay, so this is what is explained here. This PBP, they find the site of DLA sequence normally, and the PBP binds there. Okay, and that is how it creates a cross-linking. But what does this beta-lactam antibiotics do? This beta-lactam antibiotic will mimic this DLA sequence. So they bind with the PBP. So the PBP doesn't bind with this particular sequence here. That is why there is no cross-linking. Okay, so the peptidoglycan cell wall will become weak. Okay. Now, second antibiotic in the same group is a vancomycin, that is a glycopeptide. Okay. Now, what does this do? This binds with the DLA terminus. Now, here is a DLA terminus. So, what does this glycopeptide or the vancomycin do? The vancomycin will bind here. So, PBP will not act here. Okay. So, that is what is the mechanism of action of vancomycin. So, it prevents the binding of precursor to PBP. So it inhibits the peptidoglycan synthesis. So it is mainly active against the gram-positive organisms. Okay. Now third is a bacitracin. What does bacitracin do? It blocks the movement of the peptidoglycan precursors and prevents the cell wall formation. Okay. So as I mentioned, so this peptidoglycan precursors, their transport is inhibited by this bacitracin. So they blocks the movement of the peptidoglycan precursors and prevents the cell wall formation. That is how three different groups which will act on the cell wall of the bacteria that we have seen. We have seen peptidoglycan, glycopeptides, that is vancomycin. We have seen bacitracin, and first one was the beta-lactam antibiotics, in which we have four things. Okay, penicillin, cephalosporins, carbapenems, and monobactams. Okay, so I hope you have understood this. Okay. Now coming to the second mechanism of action, that is the inhibition of the cell membrane function. Okay, so this cell membrane function, the key concept is the cytoplasmic membrane that controls the transport and maintains the permeability. So once these antibiotics, they damage the cell membrane phospholipids and the fatty acids are damaged by these antibiotics. So result is that the membrane is damaged, so there is formation of pores, leakage of the cellular contents, and increased water entry, leading to the cell death. Okay, so there is a cell membrane. This cell membrane will have the fatty acids and the membrane phospholipids. So the antibiotic are causing damage to the cell membrane. Okay, especially these fatty acids and the cell membrane phospholipids. And because of this damage, there is a formation of pore, leakage of cellular contents, increased water entry, and the cell death. Okay, so the example is a polymyxin. So what does it do, polymyxin? It has got a detergent-like action. It disrupts the membrane phospholipids, cause pore formation, and mainly active against the gram-negative bacteria. Okay. Now, third mechanism is the inhibition of the protein synthesis. Okay, so inhibition of the protein synthesis. These ribosomes play a important role. Okay, so as I have already mentioned, the ribosomal structure in the prokaryotes or in the bacterium is a 70S ribosome. Okay, and it has got a two subunits, 30-unit subunit and the 50S subunit. So this is the 30S subunits and this is the 50S subunits. Okay, now they are different. These ribosomes are different from human ribosome. Human ribosome structure is a 80S ribosome. Okay. So this also you should remember from SBA point of view. Now, what are the antibiotics that will act on the 30S subunits? Okay. There are two antibiotics I have already mentioned. 30 is smaller than 50. So we will give this earlier alphabets, that is A. Okay, and 30 T, so tetracycline and aminoglycosides. Okay, now what does also there is a little difference in the mechanism of action in the aminoglycosides and the tetracyclines as far as the protein synthesis is concerned. What does aminoglycosides do? They cause misreading of the mRNA. Okay, so aminoglycosides inhibit the protein synthesis by acting on 30S subunits and causing the misreading of the mRNA. Okay, so this is what is the basic action and this is the site of action. Okay, so these both things you remember, because most of the time the question is asked about the 30S subunit, but they may ask you the mechanism, how it, so you may get confused because 30S subunit answer is not there. So they cause the misreading of the mRNA. What does tetracyclines do? Tetracycline block the tRNA RNA attachment. So tRNA attachment is blocked by the tetracycline. Remember T for T. So tetracyclines 30 subunits and the tRNA attachment is blocked. Okay, so this also you should remember. Okay, now example of aminoglycosides are streptomycin, gentamicin, amikacin. Okay, so it binds with the 30S rRNA near A site. Okay, this A site is important because there the tRNA gets attached. So inhibit the translocation. This also you should remember. So it binds with the 30S rRNA near A site, inhibit the translocation. It causes misreading of mRNA and premature termination, and this is bactericidal in action. So aminoglycosides are bactericidal in action. Okay, so they bind with the 30S subunit rRNA near A site. Okay, will inhibit the translocation and will cause misreading of the mRNA. Okay. Now we'll go for the tetracycline. How does tetracycline act? Tetracycline binds with the 16S rRNA. They prevent tRNA binding to A site. This A site is important in protein synthesis because that is the site of attachment of the tRNA to A site. Okay, so this tRNA binds with A site in the protein synthesis. So this tetracycline will prevent tRNA binding to A site, while aminoglycosides will cause misreading of the mRNA. Okay, and these tetracyclines are bacteriostatic. Okay, so remember tetracycline and sulfonamides, these are the bacteriostatic antibiotics. Okay, so the antibiotics acting on 50S subunits. Now what we have seen are the 30S subunits. Now we will talk about the 50S subunits. Okay, here I have been given the mnemonic as a CMO. So chloramphenicol, macrolide, oxazolidinones. Okay, so this chloramphenicol will inhibit the peptidyl transferase. Okay, so remember phenicol. Okay, something like a fevicol, you remember, because there is a peptide bond formation is created by this peptidyl transferase. So these peptide bonds are not formed because of this chloramphenicol. So it prevents the bond formation. This chloramphenicol does not allow the bond formation. Okay, so inhibits the peptidyl transferase. Chloramphenicol will inhibit the peptidyl transferase, does not allow the bond formation. Then macrolides will cause premature peptide detachment. Okay, and oxazolidinones will bind with the 23S rRNA. Okay, so chloramphenicol, macrolides, oxazolidinones, in which this linazolid is an example. Okay, so these are the antibiotics which will act on the 50S subunits. Mnemonic CMO, you remember, chloramphenicol. This has been asked in the past. Macrolide has been asked in the past. They may ask about the linazolid, which is oxazolidinones. Okay, so that binds with the 23S RNA. Okay, now coming to the chloramphenicol. Chloramphenicol binds with the 23S RNA. It prevents tRNA binding. And important point is that it crosses the blood-brain barrier used in CNS infections. This chloramphenicol is a broad spectrum antibiotic. Okay, it will cross the CNS barrier and it is used in the CNS infection. Second, here is a macrolide antibiotic. Macrolide antibiotic examples are erythromycin, azithromycin. They bind with the peptidyl transferase, cause premature peptide release, and usually they are bacteriostatic. Okay, again, bacteriostatic antibiotic is a erythromycin, azithromycin. Okay, another is a sulfonamides. Okay, another is a tetracycline. Okay, so if they ask you this, okay, they may ask you which is not a bactericidal antibiotic, and in which they will give you one of these, and rest of the things will be bactericidal. Okay, so macrolides, erythromycin, erythromycin are the example. They binds with the peptidyl transferase center, cause premature peptide release, and usually they are bacteriostatic. Okay, third is a oxazolidinones. Okay, linazolid is the example. It binds with the 23S rRNA of 50 subunits and inhibit the protein synthesis. Okay, now next mechanism is inhibition of the nucleic acid synthesis. Okay, now here RNA synthesis is also there and the DNA synthesis inhibition is also there. Now which antibiotic will inhibit the RNA synthesis, which antibiotic will inhibit the DNA synthesis? Okay, rifampin. Okay, remember R for R. Rifampin is an example which will inhibit the RNA synthesis. Okay, now this rifampicin or rifamycin, this inhibits the DNA dependent RNA polymerase. Okay, so this rifampicin will inhibit the DNA dependent RNA polymerase. It blocks the initiation of the transcription and RNA elongation. So broad activity against the gram positive bacteria. Okay, now DNA synthesis inhibitors. So what we have seen, RNA synthesis inhibitors, in which the example was a rifampicin. Okay, now this rifampicin was acting through RNA polymerase. So it was inhibiting the DNA dependent RNA polymerase. Now there is a DNA synthesis inhibitors, another group. Okay, so here examples are the fluoroquinolones and the quinolones. Quinolones, the target is the DNA gyrase, and fluoroquinolones target is a topoisomerase 4. Okay, so quinolones will act on the DNA gyrase. They will inhibit the DNA gyrase. Fluoroquinolones will inhibit the topoisomerase. Okay, examples of the quinolones and the fluoroquinolones are ciprofloxacin, ofloxacin, norfloxacin, etc. They inhibit the bacterial DNA gyrase and topoisomerase 4. They prevent DNA coiling and replication, and they are bactericidal in action. Okay, so basically this DNA gyrase and topoisomerase, they are required for the DNA coiling and replication. Okay, normally what happens, that this DNA is, there is a super coiling of this DNA. So when the bacteria divides, this DNA which is super coiled, that needs to be unwound. Okay, then there is a replication, and again it should be rewound again. Okay, there should be coiling again. Okay, now these two enzymes are responsible for the DNA gyrase and topoisomerase 4, and this coiling and replication is prevented by this uh, quinolones and the fluoroquinolones by acting on DNA gyrase and topoisomerase 4. They are bactericidal in nature. The last mechanism of action of antibiotic is through inhibition of the folic acid synthesis. Okay, now humans obtain the folate from the diet, and bacteria will synthesize the folate. Okay, so humans do not synthesize the folate. Humans will obtain it from the diet. Okay, now how this folate is synthesized from the PABA, okay, para-aminobenzoic acid, that gets converted into DHF, dihydrofolate. Dihydrofolate is further converted into tetrahydrofolate, okay, and this is the active form, dihydrofolate and tetra. So there are two steps involved, PABA to DHF, that is the formation of the dihydrofolate, and from the dihydrofolate to formation of the tetrahydrofolate. So the first step is inhibited by the sulfonamides, that is the PABA to DHF is inhibited by the sulfonamides. The trimethoprim will inhibit the second step, that is DHF to THF, okay. So these sulfonamides and the trimethoprim, they are the bacteriostatic, okay. So they will inhibit, the sulfonamides will act at the first step, that is the conversion of PABA to DHF, and trimethoprim will act, inhibit the conversion of DHF to THF, tetrahydrofolate, okay, which is an active form. That is why the folic acid synthesis will be inhibited. So though these are individually bacteriostatic, but when combined together, they will have the bactericidal action, okay, but individually speaking, they are bacteriostatic. So sulfonamides, they mechanism is that structural analog of PABA. So these sulfonamides are the structural analog of the PABA, and they inhibit the dihydroterate synthesis. Okay, dihydroterate synthesis is the enzyme which is inhibited, and that prevents the DHF formation, dihydrofolate formation, and this is bacteriostatic in nature. Second is a trimethoprim. It inhibits the dihydrofolate reductase, okay, that prevents the THF synthesis, second step, and this is also bacteriostatic in nature. But when these two are together, used together, they will have the synergistic effect, and they will be bactericidal, and that also reduces the resistance also. So co-trimethoprim, what we use is a combination of sulfonamide with trimethoprim, okay. So advantage is that it has got a synergistic effect and it reduces the resistance, okay. So just in short, we will revise everything. So the antibiotics, the target cell wall target is for penicillin, cephalosporin, and vancomycin, okay, and they inhibit the peptidoglycan synthesis. So antibiotics acting on the cell wall, penicillin, cephalosporin, vancomycin. Then cell membrane, polymyxin. Okay, they increase the permeability. Then we have 30S ribosome, two antibiotics, aminoglycoside and tetracycline. Okay, they block the protein synthesis. Then you have 50S ribosome. Okay, example CMO I mentioned. Okay, chloramphenicol, macrolides, and oxyzilalones. Okay, so DNA synthesis. Inhibit DNA gyrase, quinolones. Then RNA synthesis, rifampicin. Inhibit RNA polymerase. Okay, DNA dependent RNA polymerase is inhibited by rifampicin. Then folate synthesis, block folate pathway, sulfonamides and trimethoprim. Okay. Now coming to the antibiotic resistance. Okay. Now what is the mechanism of antibiotic resistance? There is a modification of the target cell. So whatever the mechanism what we have discussed, though, the bacterial cell then undergoes certain changes and will have something which will lead to the antibiotic resistance. The mechanism is, one is a modification of the target site. Second, enzyme inactivation is there. Third, it may activate the efflux pumps, then altered permeability and the metabolic bypass. These are few mechanisms by which there will be antibiotic resistance. Okay. So as far as the antibiotic testing is concerned, there are two concepts. One is MIC, second is MBC. MIC is a minimum inhibitory concentration. MBC is a minimum bactericidal concentration. The sensitivity testing is used for selecting the appropriate antibiotic. Okay. Side effects of the antibiotic are nausea, fever, diarrhea, allergy, anaphylaxis, etc. So diarrhea is commonly due to the destruction of the normal gut flora. Okay. So from examination point of view, what we should remember, beta-lactam target is a penicillin binding proteins. Vancomycin binds with the DLA-DLA sequence. Aminoglycosides will act on 30S subunits and they are bactericidal in action. Macrolide will act on the 50S subunit. Quinolones will inhibit the DNA gyrase. Then rifampicin, DNA-dependent RNA polymerase inhibitor. Sulfonamides is a PABA analog. Okay, and the first step of folic acid synthesis is inhibited. Trimethoprim will act on the second step, that is a DHF reductase inhibitor. Okay, so same thing is given here. Aminoglycosides 30S cause misreading of the mRNA. Tetracyclines 30 subunit block tRNA entry. Macrolides 50 subunit block translation. Clindamycin belong to the macrolide 50 subunit block translation. Then chloramphenicol 50 subunit inhibit peptide bond formation. Okay, so I mentioned here chloramphenicol, fevicol bond formation. Okay, peptide bond formation. Okay, then linazolid block initiation. Okay, 50 subunit. Okay, so these are the antibiotic acting on 30S and 50S subunit that you should remember. Okay, so CMO, there are two Cs. One is a clindamycin, second is a chloramphenicol. Okay, so that finishes the today's topic. Now we have few questions. Dr. Sansi, you want to go ahead with
Yes,
few
sir.
questions? Yeah, please. Yeah.
Yes, sir. A 26-year-old woman is treated with amoxicillin for streptococcal pharyngitis. Which of the following best describes the mechanism of action of beta-lactam antibiotics? Inhibition of DNA gyrase, binding to 50S ribosomal subunit, inhibition of folic acid synthesis, inhibition of peptidoglycan cross-linking, and disruption of RNA polymerase. Sir, option D, inhibition of peptidoglycan cross-linking.
Correct, correct. So inhibition of peptidoglycan cross-linking. So mechanism of beta-lactam antibiotics. Beta-lactam antibiotics bind to the penicillin binding proteins and inhibit peptidoglycan cross-linking in the bacterial cell wall. This weakens the wall and causes the bacterial lysis. Second.
Vancomycin inhibits bacterial cell wall synthesis by binding to DNA gyrase, 30S ribosome, DLA terminase, RNA polymerase, topoisomerase 4. Sir, option C, DLA terminase.
Yes. So it binds with the DLA terminus. Okay. So vancomycin is a glycopeptide antibiotic that binds the DLA portion of the peptidoglycan precursors, preventing cell wall synthesis. Okay, what does beta-lactam do? Beta-lactam mimic this DLA sequence. Okay, so PBP binds with, so it binds with the PBP. Okay, while this vancomycin binds with the DLA sequence, and that is why the PBP cannot bind. Okay, so that is what is the slight difference between the mechanism of action of these two, but finally they are acting on the cell wall. Okay, next.
Which of the following antibiotics acts on the 30S ribosomal subunit? Erythromycin, chloramphenicol, linezolid, gentamicin, clindamycin. Sir, option D, gentamicin, aminoglycoside.
Yes, aminoglycoside. Okay. So gentamicin is an aminoglycoside that binds the 30S ribosomal subunit, causing misreading of the mRNA and defective protein synthesis. So this also you should remember, because sometimes if they don't give 30S, but most of the time 30S and 50S, these are the frequently asked questions. Okay, but what do they do? Misreading of the mRNA and defective protein synthesis. Okay, next.
Tetracycline inhibits bacterial protein synthesis by blocking peptidyl transferase, preventing tRNA to the A site, inhibiting DNA gyrase, binding DLA, disrupting cell membrane phospholipid. Sir, option sir, A and B both are right, no? Preventing
tRNA binding to
B. Option B will be correct. Preventing tRNA. Okay. So T, I told you, it acts at tRNA level. Okay. It prevents tRNA binding to A site. Okay. So tetracycline bind the 30S subunit and prevent the attachment of tRNA to the A site of the ribosome. Okay. Next.
Yes. A patient with atypical pneumonia is prescribed erythromycin. Which bacterial structure is targeted? Cell membrane, DNA gyrase, 50S ribosomal subunit, DHF reductase, cell wall precursor transport. Sir, option C, 50S ribosomal subunit.
Yes, CMO. Okay. Dr. Monica, you want to go ahead with? So answer here is a 50S ribosomal subunit. Macrolide action. Macrolides act on the 50S ribosomal subunit and inhibit the protein synthesis by interfering with the peptide chain elongation. Okay. Dr.
Yes.
Monica, you want to read? Yeah.
Yes, sir. So question number 6, ciprofloxacin exerts its antibacterial effect preliminarily through the inhibition of A, RNA polymerase, B, DNA gyrase, C. Dehydropterid synthesis. D. Peptidoglycan synthesis. And E. Peptide translocation. Ciprofloxacin.
So this is a which group? Ciprofloxacin is a quinolone group. Okay.
Quinolones group. DNA
So,
gyrase.
DNA gyrase. Okay. So quinolones fluoroquinolones inhibit bacterial DNA gyrase and topoisomerase for preventing DNA replication. Okay. Next, go ahead.
7. Rifampicin inhibit bacterial growth by acting on A. DNA gyrase, B. Cell membrane phospholipids, C. 23S RNA, D. DNA dependent RNA polymerase, E. Dehydrofolate reductase. So answer D. DNA dependent RNA polymerase.
Clear? So,
Yes, sir.
okay. So rifampicin inhibits bacterial RNA polymerase, thereby blocking transcription and RNA synthesis. Next.
Sulfonamides inhibit bacterial folic acid synthetase. A. Inhibiting DHF reductase. B. Blocking DNA gyrase. C. Acting as a PABA analog. D. Binding 50S ribosome. E. Inhibiting RNA polymerase. Sir, C. Acting as a PABA analog.
Yes, sulfonamides are the PABA analogs. Okay. So they act as a PABA analog. Sulfonamides resemble PABA and competitively inhibit dehydroterate synthase and blocking folate synthesis. Next.
Trimethoprim inhibit which enzyme? A. DNA gyrase. B. Dehydroterate synthetase. C. Dehydrofolate reductase. D. RNA polymerase. E. Transpeptidase. Sir, answer is B. Dehydroterate synthetase.
No, trimethoprim will inhibit
Sorry, sir,
second
C.
step.
Answer,
So DHFR. Okay, DHFR. Okay, because trimethoprim is at second step. Okay. The first one is at dihydroterate synthesis. Okay. So
Yes.
trimethoprim blocks DHFR dihydrofolate reductase, preventing formation of THR. Next.
Polymyxin act primarily by A. Inhibiting folate metabolism, B. Inhibiting ribosomal activity, C. Inhibiting DNA replication, D. Increasing membrane permeability, E. Blocking PBPs. Sir, answer is D. Increasing membrane permeability.
Yes, polymyxin act on the membrane. Okay, increasing membrane permeability. Polymyxin damage bacterial cell membrane, causing leakage of cellular contents and cell death. Thanks, doctor.
Which of the following antibiotic is classically bactericidal? A. Tetracycline, B. Erythromycin, C. Sulfonamides, D. Penicillin, E. Chloramphenicol. Sir, answer D. Penicillin.
Penicillins are bactericidal because they destroy bacterial cell wall integrity, leading to lysis. Okay.
Which statement best explain why antibiotics targeting cell wall synthesis shows selective toxicity? A. Human cell lack ribosome. B. Human cell do not contain DNA. C. Human cell lack peptidoglycan cell walls. D. Human cell lacks cytoplasmic membrane. E. Human cell lacks protein. Best explain why antibiotic targeting cell wall synthesis shows.
Your option C. Peptidoglycan cell wall.
Yes. Last time in the last lecture, we have seen that this peptidoglycan cell wall is very specific for the bacteria. Okay, because human cells do not have this peptidoglycan cell wall. That is why the antibiotics are selective against these particular cells. Okay.
Yes.
So the answer is human cells lack peptidoglycan cell wall. So human cells do not possess peptidoglycan cell walls. Therefore, antibiotics targeting this structure selectively affect bacteria without harming human cells significantly. Okay. So we finish with today's topic of mechanism of action of antibiotics. I hope you have understood well. Thank you.